On today's show, we have Dr. Leo Moore. Now, this conversation left me very inspired. It's an interesting story that Dr. Leo Moore has. He experienced a near-death experience, and it's his health and wellness and his dedication to taking care of himself that led him to recover faster than one would think. And also, it's what led him to being the doctor that he is today. So definitely check out this episode. This is a very, very fascinating conversation we had. We obviously covered a lot more than just his near-death experience, but I think there's a lot of takeaways with this one. So enjoy. And back to walking the talk. Peace.
Welcome to Simply Walk the Talk. Our bodies and minds adapt to what we do most of the time. If you want to change your body and mind, you must change what it is you do most of the time. This podcast explores all things health, wellness, fitness, lifestyle, and biohacking. Stay tuned as we explore various thoughts, methods, and experiences from a multitude of conversations between our interesting guests and experts through many fields of work. Sit back, relax, and enjoy the show.
Simply walk the talk. Simply walk the talk.
Thanks for having me.
Yeah. So I'm absolutely happy that we finally got a chance to get you here. You know, it's been some weeks that we've kind of been going back and forth. I know you're a busy man. I'm also a busy man, and we finally got this to happen. So I'm actually very excited for the audience to be a fly on the wall as we get a chance to know each other. Me mostly getting a chance to know you, and I think your work is very important. What you're doing is very, very important, and I want to make sure that doesn't get passed over. And so I think before we start talking about some of the deeper things that you're doing right now, let's talk about your background, where you're from, how you got to being the 2024 ultimate guy with Men's Health. Let's talk about how you got your start.
It's a great question and great way to start. So I knew that I wanted to be a doctor since the age of 5 years old. I was born in Mobile, Alabama. I come from a family of nurses and preachers. So my mom's a nurse, my grandmother's a nurse, my aunt's a nurse, but then you've got my grandfather and my uncle who are preachers. And so I come from a family of servant leaders, a family of service. And I knew very early on that I wanted to be the first doctor in our family. And so I'm really grateful for my mother and my father and my family members who really supported me in that dream early on. I can even remember asking my mom for Christmas for kid scrubs and for the game Operation. And so I have a picture of myself at the age of 5 at Christmas. You can see a little Christmas tree behind me with the game Operation. And
Amazing.
It was one of the best Christmases for me because it was like, I felt so supported and I felt like this is what I want to be. I want to be a doctor and my family, is totally behind me. So, from there, I just kind of continued nurturing that goal. I remember being 14 and working at Children's Hospital of Atlanta. My family relocated to Atlanta when I was 12. And so I started volunteering at the age of 14. I also got my first job at the age of 14. I have literally been working since 14. On my birthday, that was my gift to myself that year, was to get a job. So I definitely know the value of hard work. But yeah, I remember shadowing in the hospital and volunteering there. And that really cemented that becoming a doctor was what I was meant to do. So then I went to college at Columbus State University. It's a state school in Columbus, Georgia, then on to medical school at Morehouse. And going to Morehouse for medical school was truly an amazing experience for me because I got to learn from such a diverse group of physicians and researchers really committed to serving the people of Atlanta. And so I trained at Grady Hospital, a level 1 trauma center in the heart of Atlanta, and really, got cemented in servant leadership and really taking good care of people. So from there, I went on to residency at Yale in primary care. So I moved to New Haven, Connecticut. And then from there, I landed here in LA. I did fellowship at UCLA, the Robert Wood Johnson Clinical Scholars Program. So that's a fellowship that really focuses on health policy and community research. And so I spent a lot of time over those years doing a lot of HIV advocacy work. That is an area that I've been particularly passionate about since medical school, when one of my best friends was actually diagnosed with HIV. And I also knew a lot of people and a lot of patients that I saw who were being diagnosed with HIV as well. And it really reinforced that, okay, I'm meant to be a doctor and I'm meant to serve people who are living with HIV and who are at increased risk for HIV. I will say that the beauty of life, though, is that the longer we live, the more we realize that our passions can continue to grow and that they can evolve and they can transform and that we can even have more than one passion. So, I mentioned lifestyle medicine, or you mentioned lifestyle medicine. That's something that has become near and dear to me as well. And so I look forward to just talking more about that. But that, sums up kind of my training and my upbringing. I guess the last thing I'll mention is that I'm a practicing physician now. And I also am very interested in health education and do a lot on my social media on teaching people about their health, about how to prevent disease, how to reverse disease. Because I think it's just so important that people are well informed so they can make the best health decisions for themselves and live the healthiest and longest lives possible.
That's beautiful. And I love the fact that, so we have a lot of crossover. There's a lot of crossover in your upbringing and my upbringing. Both my mom and dad were very big into the church. My father was the chief of police in my hometown. He was the EMT coordinator. He was doing so many things. And then my mom, she was also very heavily in the church and still is today. And so when you started to bring that up, I'm thinking, oh, this is great. And having the support of your family in your formative years like that is so important. It's so, so important. So this is a shout out to anybody that has young kids that have dreams. We should do what we can to support them because it's important, because we get a chance to get people like Dr. Leo here, shining, right? Did you know, or at what point did you know what like style of doctor or what route of doctorate that you wanted to go down? Did you know that at a certain point in your early years?
So in my early years, I thought I wanted to be a surgeon. And I remember learning about cardiothoracic surgeons. And I mentioned my aunt is also a nurse. And so at one point she was working with surgeons, and I learned about a cardiothoracic surgeon. So I said, oh, I'm going to be a cardiothoracic surgeon until I got to medical school and did my surgery rotation. And I instantly knew that surgery was not meant for me. It was too sterile. I mean, if you touch anything in the field, and you're not properly glove gowned, or if you, touch the wrong thing, you've got to go re-gown up and re-glove up. It also was really
like the game,
hot.
like the operation game.
That game was really the last time I enjoyed surgery.
Right. That's hilarious. That is hilarious. But listen, like I do respect the fact that at least you had a direction, because it's one thing to say, I just want to be a doctor. And then as you get deeper into what the medical field encompasses, then you realize like, whoa, there's so many different lanes I can be a part of and so many different routes. And I obviously respect the medical field and what it can do. However, I also enjoy what you mentioned towards the tail end of your intro, which was the fact that you're in this lifestyle medicine piece as well, because I think there's a lot that goes hand in hand with what we can do on our own, and then what the medical field can help us do in terms of things that we cannot do on our own, or we get into situations when we really need our medical system, So I respect that. I think that's very, very admirable. So when you decided to go down the route of, or I guess you went away from being a surgeon, what was the next step?
So the next step for me was when I found out about my friend being diagnosed. It really cemented to me that I would go into internal medicine specifically, because as I was doing my rotations, I didn't want to deliver babies. I also didn't want to take care of kids. I know there are great pediatricians out there, love them. They're very important people, but I didn't want to take care of children because of the helicopter parents, man. The helicopter parents.
Oh yeah. Oh yeah.
And the tiger mom.
Yeah, exactly. Okay, so I'm certain that was very impactful for you, and so you find out that your friend is diagnosed with HIV. So then you decide, okay, I'm now going to go down this route to help not only him but everyone else, or as many people as you can.
Yes.
And then is that kind of the route you stayed in for a while?
Yeah, so I decided I would do internal medicine so that I could care for adults. Some of the pushback that I received from other physicians and other folks in healthcare was, oh, well, adults can't change or adults are stuck in their ways. And I just don't believe that adults can't change. I believe that there are many adults who, when we can have a conversation where I can answer their questions, where I can share with them why, I'm recommending certain recommendations I'm making to them, then they can make the best decision for themselves. And often, once those questions are answered, they're going to choose help, And so it's how do I ensure that I get past those biases and ensure that I create a comfortable space that they can ask their questions or they can push back, right? Because sometimes you leave the medical establishment, you leave a clinic and you go, I didn't get my questions answered, or he wasn't listening to me, or she wasn't listening to me. And so then they go and do the thing that they'd already been doing because they don't trust what the doctor, or healthcare provider has said to them. So for me, it's been about bringing down those walls and those barriers and having real conversations with people to understand what their concerns are and then addressing those concerns and not letting them leave the room until I am for sure that, we both are clear on the plan and that their questions have been answered.
That's huge. It's a lot of what I do as well as a fitness trainer and as a health coach, right? Like it's trying to understand, meet people where they're at, try to show them that their toolkit can be a lot greater than what they think. Because, I deal with people who either believe that I need someone to always show me the way and that's it. I can't really help myself because woe is me, right? So I need to be able to have the capacity to support that type of person. But then there's a person who's just like, oh no, I don't need any outside influence, right? And so how do we kind of bring those things together? And I think it's having these conversations. It's letting people know that, I think one of the next things I wanted to talk with you about is kind of, even though you've gone through this path of getting your education, doing all of your experience in your field, getting lots of accolades, you yourself also dealt with something very, very serious, in which I imagine you had to also lean on your fellow colleagues and the medical system. So you had a near-death experience. Can you talk a little bit about that?
Yes. So a year ago, I went in for an elective surgery and I had all of my pre-workup done. I'm a very active person. I believe in practicing what you preach. So, I exercise at least 6 days a week, some weeks 7, because I'll do an active recovery day. And so I was, on that path, had an x-ray done, had an EKG done, had all the pre-workup done that was absolutely normal. And the surgery that I went in for, I had been told that, it's pretty simple, that usually, there aren't any adverse reactions, of course, right? And so I went in thinking this is going to be just fine. Well, while I was on the table, there was a moment where they had made an incision into the side of my chest and they were pumping carbon dioxide into my left side, and my heart rate plummeted. It went from, he said, about 89 beats per minute to 0 in the span of a few seconds. They immediately started cardiac resuscitation. So they got their compressions going. Thankfully, I was already on the table, so they were able to go through the entire CPR process for me. And they were working on me for about 9 minutes and 23 seconds. So I was dead for 9 minutes and 23 seconds.
Whoa. Well, okay. Wow. I mean, that for people listening, I mean, this is something I think to really take serious, because your point about going into this thinking that this was going to be, a very standard procedure, and we need to be prepared for moments when this happened. I mean, if you're watching this, you can see that Dr. Leo is very healthy looking. I imagine you look younger than you probably are, right? This is part of the benefit of us. But I mean, you're a healthy guy. You are in the medical field. You're an intelligent guy. I think you know all your stuff. You probably were very prepared, and yet this thing happens where, if you don't have your things together, like we could have, we may not have been having this conversation right now, right?
100%.
And so what did you do from that? How did things go? Because I don't imagine you finally wake up and then everything is hunky-dory and you go on your way. Like, what happened from all that?
Yes. So I wake up thinking that the procedure had been successful, but as my eyes are opening, I notice that I can't talk because they still had the tube down my throat. And so I'm looking at a nurse and I'm like, why is this in my throat? So I can still see my hand going, like this, like, why I can't talk to you. And so they put me back under, and then they take, the tube out. And so then the next time that I reawake, I'm talking to the surgeon who tells me that I experienced a cardiac arrest and that I was out for 9 minutes and 23 seconds. So I'm sitting there like, whoa, that happened? Because I don't remember anything. Like, I don't remember any stress on my body. I did not have an out of body experience or anything like that. And so, I came to thinking everything worked out fine, And so when he told me that, my mom had already been called and other family members. My mom made it from Mobile, Alabama to LA that same day within hours. She hopped on a flight, and to get a connection from Mobile would be through like Atlanta or through Charlotte. She made it a mother's love. I tell you, she got there, and stayed in the hospital with me overnight. The next morning, when the surgeon came in, I was already sitting on the side of the bed eating breakfast. And he was so surprised that after having that experience, that traumatic experience of cardiac arrest, that I was already sitting up and eating breakfast. I left the hospital, was discharged from the ICU that same day because I was able to show them, hey, I'm able to walk, I'm eating, I'm keeping my food down. And I was clear that I needed to go home to rest. I could not rest in the hospital. For anyone who has, had an overnight stay or been hospitalized, they have you plugged up to a blood pressure cuff. They, have the IV in, they're coming and checking vitals regularly. There are beeps and chirps and you're hearing noise outside of the room. There's no way you can rest there. And so I was adamant about leaving the hospital that day. And of course, my mom had flown in and she was concerned, but I said, Mom, I know I need to go home and rest. And so I went home that day. I slept most of that day. And then the next day I told my mom, I want us to go for a walk. And so we went for a walk to the nearby corner store, short walk, so that I can get up and move my body, because I know that the longer you stay down, the more deconditioned you're going to become. And as someone who had been so active, I did not want to lose ground on how active that I normally am, and so we went for a walk. The walk went well. The next day, I said, I want to go for a longer walk. And so, we went about a mile for a walk, and, I was breathing fine. And, she was able to see, okay, he really, is okay. Because, to get a phone call that your son has gone into cardiac arrest, your oldest son, your firstborn, and that you're not close enough to get to them immediately was really, traumatic for her as well. And so she was fearful that maybe this would happen again, but I knew in my heart and in my soul that moment had passed, and now it was time for me to focus on recovery. So on the third day, I actually started lifting very, very lightweight. So I have a garage gym, which is like my favorite place to to unwind after my work days. I get my workout in, so I'm out there with my music playing and I'm lifting and, singing along and dancing. You can do all that stuff when you're kind of in your own space.
Of course. Of course. Wow.
So I started lifting weights that day, like 10-pound weights, and I would do like 20 reps, and then I'd put them down because I was told that I could not lift more than like 20 pounds. So I started with 10 pounds and just did a whole bunch of reps. Don't tell the surgeon.
Smart. No, it's smart. I mean, first of all, shout out to all the moms out there. Actually, shout out to all the parents out there who are present. And the moment you were talking about your mom doing everything she had to do to make it to you, it makes me think about my mom. And, my father had recently passed away in December, but I'm so thankful that I still have my mom here because, it's moments like that make you think like, who is willing to drop anything to come and be by your side? And so shout out to your mom and shout out to all the moms out there and all the parents out there who are present. I want to ask you, what do you attribute two things. What do you attribute your recovery to? Or I guess the pace of your recovery? And then what do you think happened? I mean, is there an understanding of what happened and what caused that? And then maybe a third question. So this will be a long answer for you. Did you end up getting that elective surgery in the end?
All great questions. First, I want to say it seems like we have so much in common. I also lost my dad. So just, want to
wow.
extend, my heart to you and
Likewise.
losing your father.
Likewise.
I will say for me, as far as recovery, wait, there were 3 questions. Can you give me the questions one more time?
Yeah. What do you attribute to your speedy recovery?
Mm-hmm.
Why do you think this situation occurred in the first place, the cardiac arrest? And then did you end up getting the elective surgery you went in for in the first place?
So I think that the cardiac arrest, they're not really clear on why. They say that it was a vasovagal syncope, that maybe the carbon dioxide affected the vagal nerve and that caused my heart rate to plummet, but they're not sure.
Okay.
I think my recovery, I attribute it to 2 things. I'm a spiritual person, so I definitely think it's God. But then I also think that there is a level of discipline that I already had and was practicing in my life, from what I was consuming to my exercise to getting my sleep to limiting, risky substances like alcohol and drugs. All of the components really of lifestyle medicine, I was already living them. And so I think that my body was primed for recovery. And so that usually is my message to people, is that you may not go through a cardiac arrest. Hopefully you never go through a cardiac arrest. Hopefully you never have a car accident or anything traumatic like that. But it could even be something as simple as a relationship ending or a family member dying, right? We go through these traumatic experiences, and if we can keep our bodies and our minds like conditioned and tuned, then we increase the chances that we can recover, right? And so that has become my philosophy, and that's why I tell this story, because everyone won't go through what I go through, but we all will go through something, and how we position ourselves to recover makes all the difference.
Yeah. Well said. So did you end up getting that surgery that you went in for?
I did end up getting the surgery.
Okay. All right, cool. So it's all good. All right. Because as you're explaining this, I'm trying to put myself into the shoes of, say, another person that might have been in your situation, in which maybe the doctors wouldn't let a person out as soon as they let you out. But I guess, you knowing how you are and who you are, maybe having, your influence of being a doctor and, whatever, they're probably like, okay, go ahead. Do you now maybe look differently at someone who is also in the same situation as you? Like, for instance, I'll give you an example. I didn't think I would ever need to go in for surgery for anything, but I ended up having inguinal hernia. And so I did a very standard procedure, which nowadays is very, very regular. They can get it done. And the doctor is like, yeah, the typical recovery is about 6 weeks, 6 to 8 weeks, and it gives me this protocol. And they want to do like a 2-week checkup. And so the surgery goes well. It was, it was very standard. It was good. And, I'm at home. This is my biohacking lab, by the way. So I've got everything from PEMF to, all kinds of stuff. Like, so I'm sitting every day watching TV, just kind of recovering, doing some light walking around, but I'm using PEMF, pulse electromagnetic frequency, using that every single day. And then I had some other novel things that I like to do for my recovery stuff. I go back in for my 2-week checkup, and the doctor looks at me like, wait, you just had surgery 2 weeks ago. And I'm like, yeah. Are we good to go? We good? He's like, wait. I want to know what it is you did, because this looks like you've been recovering for 6 weeks already. I'm like, well, I talked to him about the different things. I'm a huge proponent of grounding, which I think is what helps the body at the base level be prepared for any kind of inflammation and, whatever. And so I was telling him I did grounding, PEMF, I did electrical muscle stimulation, I did all these things. And he's like, wow, I think you should write down what it is that you did so I can start giving this to some of the patients. And this is that moment that is beautiful that for me, I'm not a doctor, right? But I love working with doctors and people in the medical field that are open to some of these alternative therapies, and I get that we can't always do that because we don't know what a person's dealing with, right? We don't know, if they're going to react adversely to something. Because when you mentioned carbon dioxide, I actually work with carbon dioxide quite a bit, a lot. So that's the reason why I came up with the question of like, well, what do you think it really was? Because I know that carbon dioxide is very important. It's actually what is the carrier for oxygen. I'm sure you know this, right? And so when a person can understand this relationship, this balance between oxygen and carbon dioxide, we get the best opportunity for our cells to take in, our tissues to take in oxygen. And so a lot of people think that carbon dioxide is a waste gas, but in fact, it's used quite a lot in the medical field. It's used a bunch. So anyway, we could go on tangents about that. But I think that was a very important point in your career. What do you think you learned from that?
I learned so much from it, actually. One, I learned to trust my instincts and my body, because again, as you mentioned, my mom wanted me to stay. The surgeon would have preferred that I go to the regular floor from the ICU for a day or so. But I was very clear that and knew my body enough to say, hey, I'm good. If I need to come back to this hospital, I'll be able to come back to the hospital. It's not far. I need to recover. So that was one thing I learned from this. Number two, it was reinforcement to me that, the way that I'm living my life is the way that I should be as far as from a, health perspective. I am a doctor who wants to ensure that the way that I'm living my life reflects the recommendations that I'm giving to other people. So if I'm educating you on eating healthy, the majority of my diet is going to be healthy. And the third thing that it reinforced for me was to always be curious and to continue to learn, and so like I learned so much about the recovery process, so that way I'm then able to share with others about, trusting your body, what you should do, like different foods you should eat, making sure you're getting the right amount of water, all the things that I think are really important to recovery, but also to living our lives. I was able to, be able to impart that for future patients and people in the community. So
I can't tell you how many times I've mentioned this on this show, but another crossover point for us is that I consider myself to be one of the most curious people ever. When I was a little boy, I used to read that book, Curious George, right? I'm sure you've seen it or know about it.
Throwback.
Yeah, that's a throwback for real. And I was so obsessed with Curious George because of his curiosity and my curiosity kind of going hand in hand, to the point where like I was literally eating multiple bananas a day thinking that I was Curious Josh. You know what I mean? And like, so I was creating my own little character. And I love how you touched on 3 points about trusting your intuition and things like that. And also, if you're going to be suggesting to someone to eat a certain diet or eat healthy, live a healthy lifestyle, you also do that yourself. That's why I call this show Simply Walk the Talk, because it's like, what good does it do for me to know all the things that I know, experience all the things I've experienced, but then tell someone to do something that I don't like live as well, And so I applaud you on that. I think it's powerful.
Well, I connected with that name. I did want you to know that when I found out about this and found out about your podcast, I really connected with that name because I felt
Thank you.
like, it kind of speaks to how I live my life as well, is that we're not just going to talk about it, we're going to be about it. And you just never know who you're inspiring, by them seeing that, oh, when he says he's going to do something, he does it. You know what I'm saying? And what he's recommending to us, he's doing. And
Yeah.
be able to bring people along on the journey of when we're simply walking the talk, that sometimes we fall short. You get what I'm saying? Times it doesn't come out the way we want it to, but we are still like trying to be better every day.
Beautiful. I mean, this is making this conversation even more exciting for me because, it's like things happen for a reason, right? And sometimes we never know. But I think we are both at a point in our lives, in our careers, where we can have this beautiful conversation. And like you said, you never know who's watching, you never know who's listening. And, at the end of the day, if we can help one person, I think we've done our job, right? Let me ask you about health equity and especially your passion in the underserved communities. Can you touch on that, what that means to you, and maybe how someone could understand what that means?
Well, one major challenge for people of color, marginalized communities as well, is medical mistrust and medical distrust. And we know that goes all the way back to slavery in this country. It also goes to, and when we started slavery, because I don't want to skip this, the medical experimentation on slaves, then medical experimentation on free Black Americans, to some of the issues that we still see around there being this idea that Black people have a higher threshold for pain, or that our genetic makeup is so different. Do you get what I'm saying? And so all of these things, and then also recognizing that a lot of resources and access and even healthy land, let's think about redlining. There's so many things that have happened in this country, systemic racism, that has really put Black and other people of color at a disadvantage. And we continue, to be at that disadvantage. And so I'm passionate about that because I know that I'm not going to be able to fix systemic racism. We can attack it. We can try to fix it. Like, we can do whatever we can. But what I can do is make sure that people are educated on the best ways to care for themselves. I can make sure that people know how to advocate for themselves when they go into a hospital or into a clinic. So I am very much focused on what are the practical tips that I can give people? How can I help people to think about their health? Because how I see it, healthcare is done like in a building or when you're talking to your doctor, but health is what we live. It's what we do when we're walking through life, and we spend the most of our time ideally in that health state. So how do we make sure that we maintain that and that we preserve that?
That is so real. I mean, there's a thing, you may not know this about me, but I'm from Oklahoma. And so I've been living in New York for 20 years, but I grew up, born and raised in Oklahoma. And I grew up in a small town called Chandler, Oklahoma, right in between Oklahoma City and Tulsa. And the reason why I'm bringing this up is because of the Tulsa race riots, right? The Tulsa massacre. And I just, the more that I researched it, because it was so near and dear to where I grew up and, where I'm from and things like that, I just imagine, can you just imagine how many other Dr. Leo Moores we would have had if we would have been able to continue down that path?
How many more bankers we would have had, how many more teachers we would have had, how many more business owners we would have had, how so much beautiful potential, that was unrealized because of hate, because of racism, and I just feel like it's a challenge that we really continue to face in this country. And it's one that I continue to see so many of our people die so early. Like that, honestly, for me. And I also, because Black women live much longer than Black men, life expectancy wise. So it is particularly a concern for me that Black men are dying so early. And although our life expectancy is around like the mid 60s in comparison to like 77 or so for white men, every day I feel like I'm hearing about a man in his 30s and 40s dying, in 50s. Like I feel like it's not that median is us being kind of pulled, further in this direction. I think that it's getting younger and younger based on what I'm seeing anecdotally every day. And so that's a part of my passion, is making sure that people know, what are the ways that you can lengthen your lives, teaching people about blue zones, teaching people about like the choices that you're making, they add up. Life is a journey. We're going to ebb and flow. Sometimes we're going to make the right decisions. Other times we're not. But if we're making the right decision the majority of the time, then we're able to lengthen our lives, And so that is something that is really important to me, and that I'm always trying to share with the men in my life, the male patients that I see, and with the community.
It's important. I'm glad you spit out those data points, because it's like, unless we know, we don't really. I guess we feel like we can't do much about it, but we can. To your point is we want to take away the power from everyone else and find our innate abilities to heal, to not even just live, but to thrive. Yes. Right? We have a true opportunity to thrive in this world. And I have to say, shout out to you for making it through all the things we just discussed about our, being marginalized as a population, right? Being marginalized, but you still made it through the ranks. And I have to pat myself on the back for saying that I've been able to get to this point, but I'm not stopping, because I'm continuously curious, right? I want to learn more. I want to connect with more people like yourself. And I'm trying to do what I can to build a community, like you're doing, of people who are looking to better themselves, period.
Period.
Right? So, I mean, anything I can do to support that, let me know. And I know I think we mentioned before recording, I'm going to be out in LA at some point. I travel a lot, but
we got to
link up, because I want to hit one of those workouts with you. I hope you're doing more than 10 pounds nowadays, though.
I made it up to 20.
Okay. All right. Well, listen, hey, at the end of the day, you still are. You said it was about a year ago, right?
It was. I'm okay. Well beyond 20. I was joking.
Okay.
I'm back. I'm back to my max.
Good. I do have some interesting things that we can talk about. I kind of briefly touched on it before about electrical muscle simulation, but my company has designed some stuff that we could talk about, because I love working with people at your level to be able to help open the eyes. Because if you say electrical muscle simulation to the average person, they're like, is that the things you put on your abs and you watch TV and eat whatever you want? And it's like, no. I mean, that is in the umbrella of electrical muscle simulation, but what we've created is amazing. And so if I can have an opportunity to try some of these things out with you and kind of get your feedback on it, I would love to. But we're not here to talk about that today. So we'll talk about that another time. I would love to talk a little bit more about your HIV advocacy work, because I know you're a member of the United States Presidential Advisory Council on HIV and AIDS. And I want to know sort of how people listening and watching can sort of understand more about that, but then also maybe ways we can support.
Great question. So the United States Presidential Advisory Council on HIV and AIDS reports to the Assistant Secretary of Health for the Health and Human Services Division within the United States government. And I've been on the council for about 2 years now. We travel around the country and go to different places where there are high levels of HIV, and we meet with community members. We meet with local government there as well. We really advise based on what we're hearing from community. So for me, being on PACHA, which is a shorthand name for it, being on PACHA is an extension of my wanting to always have my ear to the ground of what community is concerned about, and to be able to advocate for them and along with them. And so that's my favorite thing about being on Pacha. And also, we write letters and resolutions that go to the Assistant Secretary of Health. And then those letters can be used to help advocates in their local communities to advocate, with their local government in areas that may have outdated laws on the books. For example, around HIV criminalization. Someone is living with HIV and they have sex with someone who's not living with HIV. They can be criminalized if that person, becomes positive, or sometimes even if that person does not become positive. And so, that's an example of some of the work that group does. I would say for everyone that's on or that's listening and that's watching, it's important for them to know that one of the best ways to advocate is actually to get your own HIV testing done. And the reason I say that is that we know there are so many people who are living with HIV who are undiagnosed, who have not had an HIV test. And so the CDC actually recommends anyone age 18 to 64, although I recommend as long as you're having sex, to get tested at least once in your lifetime, and to get tested more frequently if you're regularly having condomless sex. So, that's one thing that I would say. Another thing that I just want to share, because I think it's so important for people to know, is that there's actually a medication that can prevent HIV that a person would either take daily, or they can get an injection in the butt every 2 months. And it prevents them from getting HIV if they come in contact with someone who has HIV. So say they have sex with someone who has HIV unprotected, or the condom breaks, for example, then they will be protected from HIV by taking these medications. And it's a common misconception that it's just for the LGBTQ plus population and community, but it really is an option for everyone. And I also think, unfortunately, that there are people who think that because you're in a relationship, that you are protected, when unfortunately a relationship can give us a false sense of security. So that's not to say in every relationship, but they can give that false sense of security. And at the end of the day, your sexual health is your responsibility. That's always my message to folks, is that you can't blame it on that partner for stepping out of a relationship. It's up to you to think about, how am I going to protect myself and live my healthiest life? And I see sexual health as just a component of your entire overall health. I don't put that separate. To me, it's right there with mental health, it's right there with your physical health, it's right there with diabetes screening, colon cancer screening, prostate cancer screening. All of those together are a part of our overall health and a part of the lifestyle medicine that I spoke about, that getting all of this testing and getting all of your ducks in a row, if you will, help you to live the longest and healthiest life possible, and to thrive, as you mentioned.
Very important, very beautifully said. Thank you. I mean, I can tell you have a passion for this, so it comes through. So thank you for sharing that. I have a question, because obviously I watch TV, right? And so whether it's watching TV or social media, whatever, I feel like the way that some of these HIV prevention medications and procedures or treatments are being rolled out, it's almost being rolled out in a way such that people do think it's only for the LGBTQ community. What are your thoughts on that?
I completely agree with you, and it's frustrating, quite frankly. And the
Yeah.
reason I say it's frustrating is because what I see is that they try to hit too many populations in one commercial.
For real. For real.
So you
Like-
got the gay man, then you've got the couple, then you've got the single Black woman, then you've got, and I attended one of our PACHA meetings recently, and there was a Black woman on a panel about Black women in PrEP, and she talked about how on those commercials they're so short that there's usually just a Black woman twirling. Like, she'll do one twirl and then it's done. So that was like your Black woman moment in the commercial. So my advice to them would be, create commercials that are curated for different populations. You don't need to try to hit everyone, in a 30-second commercial. Really tailor it to the people that you're trying to reach, because honestly, those commercials totally reinforce what you say, which is that people see those commercials and say, that's not for me. I don't
1000%.
identify with that person, or I'm not LGBTQ, then why should I even think about this? And it's doing a disservice to, everyone, quite frankly.
Yeah. I mean, obviously, we understand what they're trying to do. It seems as if they're trying to go for the highest risk population. However, there does need to be more of a conversation. I think the fact that we're having this conversation should help shed some light on the situation, because they're doing that for reasons I think we kind of know what they're doing it for, but let's not miss out on all the other opportunities to educate people, you know?
And let's also not forget that there are a lot of people who don't even identify as gay, who maybe they're trying to reach them in that commercial, but they're missing them too, because the way that we identify is not nearly as important as us all thinking about, is this something that I could benefit from? And I think when we take that stigma off, or if we take off that, there may be some concerns around homophobia, transphobia, et cetera, and we just get down to the fact that this is about preventing disease, then we're able to help people to think about, could this be a tool for me?
So powerful. Yeah, I mean, obviously, you're on the right panels, and I think you're a great voice for everything we've just discussed. So I look forward to seeing more changes, hopefully, right? And I think, like, because I live here in New York, there's a huge opportunity to educate, right? Because you said it at the beginning. There's a lot of mistrust and distrust in this information that we're being provided. And so if a person is not like us and not curious enough to go out and understand for themselves what they need to learn, or at least what they hope to learn, then they're kind of like, yeah, well, I didn't hear about that, or I don't know about that, and then it just continues this cycle yet again, Hopefully people listen up.
Yeah. Well, honestly, Josh, I think more conversations like this are what can really move the needle. Honestly,
Right.
It's conversations where there's a two-way dialogue. I don't believe that there's any ad campaign that's going to be able to bring us through any pandemic or epidemic. It's usually conversations. People have questions that they need to have answered. And so that's why I do so much on my social media as well. And why, in my comment section, I make sure that I'm responding to people's questions, because it's those questions that are keeping people from sometimes making the best decision for themselves. When we have questions, we often will stagnate, because we're like, I don't know which direction to go, because, I'm not clear. So the more that we can make things clear for people, the better decisions are better, well-informed decisions that they can make for themselves.
One of the things I say time and time and time again, and it's something I actually live by, is this analogy, or this idea of anytime there's a question, there's an opportunity to educate. Okay. Doesn't always mean that whatever response comes out is the right response or factual or whatever, but it's always an opportunity. It's like a window. If you want to go through the window, is that window locked? Is it slightly open, or is it all the way open? And I want to make sure that we ask more questions so we have more opportunities to educate.
I love when there's a question, Josh, because when there's a question, that means that person's thinking. That means that person is dialed in enough to even have that question. It's when a patient comes in and they're like, no questions at all. I'm like, was I effective in sharing what I shared, and were you fully present with me? It could be that I answered all your questions, but it also could be that you were kind of checked out or glazed over throughout what I was saying. So when there's a question, I feel like, great, this person's dialed in enough to ask a question. They're engaging with me. Let me answer that. And then let me ask, what other questions do you have for me? And I don't ask, do you have any other questions? I ask, what other questions do you have for me? Because I want to prime that person to know that, hey, I'm here with you. What else do you want to know? What else do you need to know that's going to help you make the best decision for you?
And I'm sure you can understand that people on the other side of the medical professional, some of them are maybe intimidated is the right word. They're intimidated by the whole process in general. So I'm sure you get it. And I imagine you have great bedside manners, and I'm sure you're very approachable because you've been with me. We just met for the first time via this video. So I imagine that it's, you're providing a very safe environment for people to talk, but it's just like going to therapy, right? You know how hard it is to get people to go to therapy, especially Black men, right? And so, it's like, my whole thing is like, I try to to encourage people to just be open, right? Because there are no dumb questions. There are no, like, nothing is off the table. We could talk about anything. That's how I am with my homies, right? Like, and when I say homies, it's not just the fellas, but it's like people that I would bring into my network, into my community. We're going to have real conversations. We're going to have real conversations, right? It's not always this surface level, what's on your TikTok, on your social media. Like, let's talk about, are your parents living? Are you confident about how you look? Do you feel healthy, right? Like, are you nervous about this relationship you're in? Like, let's talk, right? So yeah. Anyway, it's a tangent. I'm just going off.
No, it's a good tangent because it's something I've been reflecting on because, I think that social media, this age of social media, has people having a distorted image or reality of what it means to have a real connection and a real friendship, a real relationship with another person. And, it sets people up to think that, oh, well, if we can party together or if we're having fun together all the time, then, that's a friend. But, for me, my best friends, I know their parents. I know, if they're having a good day or a bad day, I'm going to hear about it because we're close. If they need something, they know they can come to me. We're there for each other through the good and the bad. We go on life's journey together, And so what you're saying totally resonates with me. I even said, your real friends are not the people that you run into at an event. They're the people who invited you to the event. I shouldn't make it to the event and you're like, hey, good to see you. No, your real friends invited you to the event. You came with them or you were meeting them there because you already had decided we're going to this event together.
That's powerful. We can clip that one, Gordon. No, because that's really powerful. When you were speaking on that initially, it made me think about my real friends. I think people think that just because you friended someone on social media, just because you talk to them through text every once in a while, right? Like, sometimes, like, some of my closest friends, one of my best friends, his name is Josh, right? And we grew up together, and we've been through everything together. I was there when his son was born, and he's met my kids. I have 2 small kids that live overseas, and we've been through everything together. He was there when my father passed away, and we talk maybe once a month, but that doesn't matter. It's not about the frequency, right? It's about the depth. Right? It's about the depth of a friendship, of a relationship, right? And so, and every once in a while, he'll send me something on social media that maybe gets cycled through social media about, you are my brother. It almost doesn't matter because he's a white boy, right? White guy. And it was always white Josh, black Josh. That's how we always grew up, right? Grew up in Oklahoma, mind you. Okay. But, it's like a lot of the messages that we can resonate with is the fact that, like, even though we don't have the same mom, even though we don't have the same dad, we are brothers. I lived with him. He's lived with me. Like, we've lived together. We've been through so much turmoil, but we've also been through so much beauty. And that's what's powerful, And so I have a handful of those people in my life. Handful.
That's a brotherhood. That's a true, deep friendship and connection that is lifelong. That's what I think of when I think of a real friendship, quite frankly. Like, that was a great example to me of how I view friendship and what I want from a friend. When I am intentional about starting a friendship with someone, I'm very clear that I'm going to ask you a lot of questions because I really want to get to know you. I don't want it just to be that, like, we're on the surface, because if we're just going to be on the surface, then we're just acquaintances. And I'm a bit of an introvert anyways. I have a few friends and we go deep, and then everyone else is like, hi, how you doing? And kind of bye, because we're not close.
Yeah. I think you're spot on by saying that social media has contributed to that a lot, because it's like my best friends may not have ever seen any of my posts, but all the acquaintances have, right? And they know me for what my social media is saying and what my social media is doing. But in the background, I'm having real deep conversations, right? I don't put my family, my kids, you won't see any, well, you maybe see the back of their heads, on my social media, but I don't put much of my very personal stuff on social media. It's not that I'm ashamed or embarrassed about it, but it's because I need to be able to keep something for me, for
Yes.
my close community.
Yes.
It's not, I don't want to put all of me. You know how much I give of myself? I'm sure you do as well.
Yes.
What do we keep for ourselves?
What do we keep for ourselves?
It's
Yes,
sacred.
100%. It's right. So that we don't
Yeah.
lose ourselves.
Facts. Oh man, I feel like we could do this forever. This has been amazing. But before we start wrapping up, I want to make sure, because I know you've got a lot of depth to you. I want to make sure that I've given you an opportunity to speak about what you really want to talk about today. Is there anything else that you can think of that we maybe haven't touched on? And if we don't touch on it today, I'd love to have you back on, because maybe we do this in person next time, But is there
That'd be
anything else
fun.
that is important for you that we haven't had a chance to touch on today?
No, I mean, I feel like it's just been such a great conversation, honestly. I feel like I got to share a lot, and I feel like we just have a lot in common. So I'm really
Likewise.
glad that I've been able to be on the show.
Likewise. I want to ask you a couple questions that I ask every guest that comes onto the show. And the reason why I like to ask these questions is because after we go through this back and forth conversation that we've just gone through, I want to also offer people an opportunity to get to know the person a little bit deeper. Right. So we just talked about depth of a person. So one of those questions, and it's kind of a lighter question that allows for this opportunity to be maybe funny. Maybe it allows for an opportunity for your community to know you better, to know how to act around you, maybe a little bit. So that the first question is what are your top 2 pet peeves? What are 2 pet peeves that come to mind now today?
So one actually kind of goes to the name of your show, which is don't talk about it, be about it. That is important to me. When someone says they're going to do something, I'm expecting that they're going to do it. And if they're not going to do it, then they need to let me know. Don't just talk about it, be about it.
I like that.
Let's see. Another pet peeve. Another pet peeve for me is when I can tell that someone is not truly being themselves. Like if they're putting on a front, that also, is a pet peeve for me. Be yourself, and hopefully I create an environment where people feel comfortable being themselves with me. And this is, outside of a professional environment. I recognize what you're saying about a professional environment that, I am physician, they are patient. But to me, I sit at the same level with my patients. I turn away from the computer and I'm focused on them. So I try to do what I can, to make them feel that they're a priority and that time with them is valuable to me as well. But in friend groups and when I'm around people, I don't like to feel like someone is fronting or someone is trying to put on, because I can see through that and it makes me not trust them.
Yep. I mean, it's so important that I think not only does that become important in like a friendship group, but also in relationships, right? Because a lot of times, especially today with the dating apps and the social media, we get to know a person on a surface level. We obviously need to be attracted to someone. Obviously, we want to hope the best for someone, but we need to be more sure about what the person is showing you is actually who they are.
Mm-hmm.
Because if they're not, then that should be a red flag, right?
Mm-hmm.
Because of course, if I'm going to meet, someone like a young lady on a date, I'm going to obviously maybe hopefully, put on some nice essential oils, and I'm going to, take a shower. I'm going to present myself in the best light because I'm going to do that anyway. I'm not doing that for her, or, I'm doing that for me because I want to feel my best. Right. But then if the rest of the time, as we get into a relationship, if I don't shower often, if I don't brush my teeth, I got bad breath, I got, my place is looking messed up, then that is being a fraud. Right. And so I think we need to show up, be more authentic in every relationship that we present, So I'm with you on that. I like that pet peeve. That's a good one. Be yourself.
People often send their representative and they can only send their representative for so long,
Well said. Okay. My last question is by far one of my most important questions. And I think it's probably my favorite question because I like to get to know what makes people really tick? Like what gets you out of bed each day? What drives you? And so that question is, what is something you're most grateful for?
The thing I'm most grateful for is having a sense of purpose. And having felt that sense of purpose and a clear kind of mission for who I was meant to be early on, that to me is a blessing, because it has directed my life for so long, and so that is something that I'm so grateful for. And I think that it kind of spills over into the way that I live my life. It spills over into me ensuring I'm eating right, me ensuring that I'm getting my workouts in, sleeping, having quality social connections, as we just talked about, all of those things that also then kind of pour back into that purpose and into fulfilling my mission. So that would be what I say I'm most grateful for.
So you just prompted another question, if you will allow. I think this is kind of interesting, because I don't know why this came up, but I like to listen to my intuition, so I'm going to ask it. Given all that you've been doing throughout your career and your life and fulfilling your purpose and all that, what would you do if you weren't able to be what you are right now? Right? Like this doctor that is doing everything that you're doing, advocacy for HIV and everything else that you've done today. What would you be doing if you weren't doing this, or you could no longer do this?
That's such a fun question, because around the time that I decided to be a doctor was also around the time that I discovered that I could sing. And so
I knew it. I knew
so I've
it.
also been singing since I was like 5. And so music for me has been, something that has really stayed with me throughout my life. And it is my escape. I don't really sing publicly often, but when I do, I have kind of like a John Legend type sound. And so I would sing. I would sing and I would make music. And I think that creative side of me has also helped me in my career as well, because I'm always thinking outside of the box and being curious and all those things that we've discussed. I think a part of that is because there is that creative side of me.
I love that. All right. I think you just spurred an additional question I'm going to start asking future guests. So thank you for that inspiration. How can people best keep in touch with everything you have going on? Can you maybe mention your social media handle and your website and things like that?
Yes. So you can find me on Instagram and Facebook at Dr. Leo Moore, Dr. Leo Moore, on TikTok at Dr. Doctor Leo Moore, and then on my website, drleomore.com, drleomore.com.
And the so Moore is spelled Ore, yes?
Correct.
Yeah.
Mm-hmm.
And obviously we will make sure all this information is easily accessible in the show notes and the description, so people can click and go forth and stalk you, I guess.
Well, I will say I encourage people to follow, because there's so much health information that I'm also sharing. For me, those pages are meant to be useful to people. And so like that is a part of my purpose. Like I've been told that I come alive when I'm educating other people, and so for me, it brings joy to be able to even create those pieces of content that I share. And it's usually short form videos or little carousels that have information. For example, one that I love that I created recently was around men's health screenings by age. So you can literally go through and say, I'm 35, and you look at the 30s and see what the screenings are that are recommended for you. So useful information that people can access and, try to then ensure that they stay in good health.
Well, I want to wholeheartedly thank you again for your time. I know your time is valuable. I don't take it for granted. So thank you for all that you do. Thank you for your time. Thank you for coming on to the show. And I look forward to connecting in the future and hopefully having you back on the show again.
Thanks so much for having me, Josh, and looking forward to the link up in LA.
Definitely. All right. This is Josh signing out from Simply Walk the Talk. Until next time. Peace.
Simply walk the talk.
Walk the talk, talking facts. Move like me, but I move a little fast. Make my move, here to last. Fasten these seatbelts, I'm coming past. Take care of me, longevity. Hack my biology, better believe. Walking the talk, soul, mind, and body connected. Better come give us a listen.